All right. Ready to dive in today. We're tackling hypophosphatasia, HPP for short.
It's a rare bone disease. You might not have heard of it.
Right.
And get this, even baby teeth can be affected.
Wow.
Yeah, it really caught my eye. I had to dig into this one.
Makes sense.
So we'll unpack it all. Causes, symptoms, diagnosis, everything.
Sounds good.
But first things first, I got to start with the basics.
Okay.
It seems like everything hinges on this thing called tissue-nonspecific alkaline phosphatase.
ALP for short, right?
Yeah, ALP.
So what ALP exactly, and why is it so crucial for, like, our bones and teeth?
Well, think of ALP like a construction worker,
Okay.
but for your bones and teeth, right?
Right.
It's an enzyme. And its big job is mineralization.
Mineralization.
Yeah, it's what makes those bones and teeth strong, sturdy. Like, imagine building a house. You need strong bricks, good mortar, right?
Yeah, definitely.
ALP is like the worker making sure those bricks, that mortar, are all bound together, makes the whole structure solid.
So no ALP, shaky house.
Pretty much.
Which actually, now that you mention it, explains something I found in the research. It talked about rickets-like bone changes in HPP.
Interesting.
Yeah, and most people know about rickets, right? Soft bones, usually from not enough vitamin D.
Yeah.
So it's like in HPP, without that ALP construction worker doing its thing,
Yeah.
bones are going to be weak, maybe deformed, just like rickets.
Exactly.
Makes you wonder, because I feel like when we hear bone disease, we think, oh, that's a kid's thing.
Right, right.
But the stuff you sent over really hammered home that HPP. It can affect anyone at any age, not just kids.
Oh, absolutely. Infants, children, adults. We see it across the board.
Yeah.
The way it shows up can be really surprising. Lots of variation.
Surprising how... Give me the rundown. What kind of symptoms are we talking about?
Well, in infants, you might see things like they're not growing as expected, muscle weakness, even breathing problems.
Breathing problems? Why would that be?
Because their chests, their ribs aren't developing the way they should.
Ah.
And then in
exactly.
children and adults, you see things like lots of fractures, especially in the legs, bone pain, even. This one's kind of out there. Premature tooth loss.
Hold on, wait. Premature tooth loss? Like, their teeth they just fall out? I've got to know more about that.
It all goes back to that mineralization thing we were talking about.
Right.
ALP. It's essential for strong teeth, not just bones. So without enough of it, it's like the cement holding those teeth in weakens.
Oh, wow.
And then, yeah, teeth can loosen, fall out way too early.
That is wild. Never would have connected those dots. So you've got this disease that can hit at any age, symptoms all over the place, skeletal problems, breathing, even teeth. How do you even diagnose this? Seems like it'd be easy to miss.
It definitely can be tricky, partly because it's so rare, and the symptoms, they can look like other things too.
Right.
But there are a few key things doctors look for. Simple blood test. That can show if ALP levels are low.
The enzyme, right.
Exactly.
Yeah.
And when ALP is low, other substances in the blood, like PLP, PKA, those tend to go up.
So it's like a signal.
Yeah, like the body's trying to say, hey, something's off here.
So low ALP, that's the first clue. And then if they find high PLP, high PEA, does that basically confirm it's HPP?
Not always, no. It gives them more to work with, but
Yeah.
doesn't tell the whole story. Usually, to really be sure, they'll do genetic testing.
Okay. Makes sense. So that's to look for the specific gene mutation, the one that's causing the ALP deficiency in the first place.
Exactly. They analyze the genes, especially the ALPL gene.
Yeah.
That's the one responsible for making ALP.
Right.
And by finding that mutation, then they know, okay, this is what's causing it.
So someone IS diagnosed with HPP, what's next, treatment-wise? I saw you'd sent over some info about this enzyme replacement therapy, ERT they call it.
Yeah, ERT. It's pretty amazing, actually. Big advancement for HPP.
So what is it like in a nutshell?
Basically, they give the patient a synthetic version of the ALP enzyme, the one they're not making enough of.
Oh, interesting. So kind of like supplementing what their body's missing.
Exactly that. Like, remember the construction site analogy?
Yeah.
It's like sending in a whole crew of those skilled workers to help get the building done right.
So they're getting a boost of that enzyme. Does that mean ERT cures HPP?
Important to remember, it's a treatment, not a cure.
Right, of course.
Think of it like, say, managing diabetes. Doesn't fix the underlying problem,
Right.
the genetics, but it can make a huge difference.
Okay, yeah.
ERT can make bones stronger, fewer fractures, less pain, but they usually have to stay on it long term.
To keep those benefits going, that makes sense. Are there, I mean, even with something this cutting edge, I have to imagine there are challenges. I think I saw something in the research about the cost of ERT being a big barrier.
Unfortunately, yeah, that's a big one.
Yeah.
It's very expensive.
Is that because it's so, I don't know, specialized? Difficult to make?
It's a complicated process, yeah. Biological therapy, manufacturing, all that factors in.
Man, that's tough. I mean, it makes you realize how much harder a diagnosis like this can be for families on top of everything else.
It's a valid concern, definitely. And of course, managing HPP, it's not just about medication. There's a lot of supportive care that goes along with it.
Right, of course. Things like physical therapy and, physical therapy to help them stay mobile, build strength.
Huge, yep. And pain management, too, of course. HPP can be really tough, symptom-wise.
Oh, absolutely. Can't forget about that aspect.
And since we were talking teeth before, dental care is so important with this condition.
Makes sense with everything we've learned about how it affects teeth.
Regular checkups, preventative stuff, really crucial.
So it's really a team effort, huh? Managing HPP, specialists, proactive care. We've covered a ton of ground here. The science behind it, diagnosing it, treating it. What do you want listeners to walk away with? What are the key things to remember?
The big one is, even though it's rare, HPP can happen to anyone, any age.
Right. We've established that.
And the earlier you catch it, the sooner you can start treatment. That makes all the difference.
Absolutely. Early diagnosis is key with so many things.
Huge. So if you're having blood fractures, bone pain that won't quit, muscle aches, even dental problems that just seem weird, talk to your doctor.
Don't ignore those signs. Better safe than sorry, right?
100%.
Well, folks, there you have it. Hypophosphatasia decoded. We've gone from the basics to some pretty surprising details, wouldn't you say?
It's been great unpacking all this with you.
Always fascinating to dig into these rare conditions. And remember, if you want to learn more, we've got links to all the resources we mentioned in the show notes.
I think check this out.
Until next time, stay curious, everyone.